Medications are our allies in health, but did you know that some of them could be silently damaging your kidneys? The kidneys are essential organs for life, acting as highly efficient filters that purify our blood of toxins and waste substances. Without this essential function, our body would be inundated with harmful metabolic products, leading to widespread poisoning and eventually death. We all long to reach our full physical and mental potential. We aspire to a life full of vitality, where our body is a faithful ally. Currently, there is a marked tendency to seek quick and effective solutions for any health problem. Medications have become the first line of defense for many, offering the promise of relieving symptoms and treating illnesses almost immediately. This search for quick results has led to a significant increase in drug use, both prescription and over-the-counter. Did you know that some medications you take daily could be harming your kidneys? You will be surprised to know which are the 7 everyday medications that secretly destroy your kidneys. They are medications known to most of us.
1. Non-steroidal anti-inflammatory drugs. Known as NSAIDs, they are a group of very common medications that are used to relieve pain, reduce fever, and reduce inflammation. Inflammation is our body's natural response to injury or illness, but sometimes it can cause discomfort. NSAIDs help control this inflammatory response. These medications, such as ibuprofen and naproxen, are the best-known NSAIDs. They are prescribed for those who suffer from inflammatory conditions and associated pain, such as pain, headaches, muscle pain, menstrual pain, joint pain, inflammation, arthritis, tendonitis, bursitis, fever associated with colds, flu. Non-steroidal anti-inflammatory drugs work through a very precise mechanism. They block a key enzyme called cyclooxygenase. This enzyme is essential for the production of prostaglandins, substances that trigger the inflammatory response in our body. By inhibiting cyclooxygenase, NSAIDs reduce the production of prostaglandins, which in turn reduces inflammation, pain, and fever. However, that is not the only function of prostaglandins. They also help maintain blood flow to the kidneys.
If your levels decrease, then the blood reaching the kidneys will also decrease. Some of the cells will die, and kidney function will deteriorate. This is called kidney disease, where not enough oxygen and nutrients reach the kidney cells, causing acute kidney injury. Elderly patients with pre-existing kidney disease should take special care if they are using non-steroidal anti-inflammatory drugs. What are the side effects? Although NSAIDs are generally safe if taken under close medical supervision, they can cause side effects in some people, such as stomach problems, nausea, heartburn, ulcers, kidney problems, especially in people with pre-existing kidney problems, increased risk of bleeding, especially when combined with other anticoagulant medications. The use of such medications has been associated with a 66% increased risk of kidney damage. 2. Angiotensin-converting enzyme inhibitors. Angiotensin-converting enzyme inhibitors, or ACEIs, are medications designed to regulate blood pressure. They work by relaxing blood vessels and reducing the amount of fluid in the body, which decreases the force with which the heart has to pump blood. This helps keep blood pressure within a healthy range. Among the most commonly prescribed ACEIs are enalapril and ramipril. Hypertension, or high blood pressure, is a major risk factor for heart disease, stroke, and kidney damage. ACEIs are essential medications in the treatment of this condition. They work by preventing the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is a powerful vessel constrictor, meaning it causes your blood vessels to narrow and increase their blood pressure. When you take angiotensin-converting enzyme inhibitors, they decrease angiotensin 2 levels, which widens blood vessels, including those that supply your kidneys. It is crucial that the blood that reaches the kidneys does so at a relatively high pressure to assist in the blood filtration process. That is why the use of angiotensin-converting enzyme inhibitors could affect kidney function or worsen existing conditions. In fact, a study was conducted to investigate the effects of taking angiotensin-converting enzyme inhibitor drugs on the kidneys of patients with hypertension or heart failure. The researchers measured changes in serum creatinine levels as an indicator of kidney functions. The increase in serum creatinine levels simply means a deterioration in kidney functions, which is what they actually found in 1 to 2% of the participants. ACEIs are very effective medications for controlling blood pressure, but it is essential to follow your doctor's instructions and take them regularly. Its effectiveness depends on proper and continuous use. If you are taking ACE inhibitors, it is important to consult your doctor if you have any questions or experience side effects. 3. Angiotensin. 2. Receptor blockers. Angiotensin, 2 receptor blockers, also known as ARBs or sartans, are a type of medication primarily used to treat high blood pressure. These drugs help relax blood vessels, which decreases pressure on the arteries and heart. How do they work? Angiotensin II is a hormone that narrows blood vessels, increasing blood pressure. These medications prevent angiotensin II from binding to its receptors on blood vessel cells. By blocking this junction, blood vessels are prevented from narrowing, which leads to a decrease in blood pressure. What are they used for? In addition to treating hypertension, ARBs are used to heart failure. They help strengthen the heart and reduce workload. Kidney disease. They protect the kidneys and reduce the risk of disease progression. After a heart attack, reduce the risk of death and other cardiovascular events. Unfortunately, like inhibitor drugs, it also leads to a similar effect on the kidneys. The use of angiotensin, 2 receptor blockers among patients with hypertension, diabetic nephropathy, or heart failure, has been associated with a 1 to 3% incidence of acute kidney injury. 4. Diuretics. Diuretics are medications designed to remove excess sodium and water from the body through urine. This action helps lower blood pressure and relieve fluid overload, which is essential in the treatment of diseases such as hypertension and heart failure. By reducing the volume of fluid circulating through the body, the load on the heart and blood vessels is decreased, thus improving cardiovascular function. Additionally, they may be useful in treating other conditions, such as chronic kidney disease and certain types of edema, in which the body or parts of it are swollen due to water buildup in the tissues. They can improve breathing in people who have difficulty breathing due to fluid buildup in the lungs. There are different types of diuretics, each with a specific mechanism of action. Thiazide diuretics. These are most commonly used to treat mild to moderate hypertension. Some examples are hydrochlorothiazide, chlorthalidone, and metolazone. Loop diuretics. These are more potent than thiazides and are used to treat more serious conditions such as congestive heart failure and chronic kidney disease. Furosemide is the best-known loop diuretic. Potassium-sparing diuretics. These medications help prevent the loss of potassium, a mineral important for heart and muscle function. Some examples are spironolactone and amiloride. How do they work? Diuretics act on different parts of the kidney, blocking the reabsorption of sodium and water. By increasing sodium excretion, more water is also removed, leading to a decrease in blood volume and blood pressure. Side effects. Diuretics can cause some side effects, such as dehydration if too much fluid is lost, electrolyte imbalances, especially potassium loss, dizziness caused by decreased blood pressure, and muscle weakness. When used in excess, these medications can negatively affect the kidneys that will not be able to perform their function properly. Diuretics can cause acute kidney injury in 2 to 7% of patients, with a higher incidence in those taking high doses or multiple diuretics. 5. Protein pump inhibitors. PPIs are medications that act directly on stomach cells, significantly reducing acid production. Imagine that your stomach is a factory of hydrochloric acid, necessary for digestion, but sometimes it produces too much. PPIs are like a switch that decreases the production of this acid, thus relieving the symptoms of heartburn and other related conditions. How do PPIs work? As their name suggests, PPIs act directly on the proton pump, an enzyme found in stomach cells that is responsible for the production of hydrochloric acid. By blocking this pump, PPIs significantly reduce the amount of acid in the stomach, which relieves symptoms and promotes healing of injuries. There are several types of PPIs, each with its own trademark. Some of the most used are omeprazole. One of the first PPIs to be developed, it remains very popular. Common brand names include Prilosec and Losec. Esomeprazole. It is a purer form of omeprazole and is considered more potent. Popular commercial brands include Nexium, Lansoprazole, another widely used PPI. Common brand names include Prevacid, Pantoprazole. Known for its rapid action, it is used to treat acute conditions such as erosive esophagitis. Common trademarks include Protonix. Rabeprazole. another effective PPI, although less common than the previous ones. When are PPIs used? PPIs are prescribed to treat a variety of conditions, including peptic ulcers, both in the stomach and duodenum, reflux esophagitis, inflammation of the esophagus caused by stomach acid, gastroesophageal reflux, a chronic condition that causes frequent heartburn, Zollinger-Ellison syndrome, a rare disorder that causes excessive acid production. They may also be prescribed to prevent ulcers induced by non-steroidal anti-inflammatory drugs. Benefits of PPIs. They usually relieve the symptoms of heartburn in a few hours. They promote the healing of peptic ulcers. They reduce the risk of complications such as esophageal cancer. Unfortunately, PPI medications, despite their benefits, have been linked to an increased chance of developing acute interstitial nephritis. This is an inflammatory condition of the kidneys that can lead to chronic kidney disease if not addressed immediately. This kidney condition can arise as a side effect of these drugs, which represents an additional risk to the health of those who consume them. Data analysis studies revealed that about 0.4 to 1% of long-term PPI users develop acute interstitial nephritis that can progress to chronic kidney disease if not identified and treated early. 6. Antibiotics. We all know that excessive and unnecessary use of antibiotics is very harmful to our body. The abuse of antibiotics, whether through excessive doses or unnecessary treatments, represents a serious threat to our health. This practice promotes bacterial resistance, making it difficult to treat future infections and putting our lives at risk. How can antibiotics affect the kidneys? Antibiotics can damage the kidneys in several ways. Interstitial nephritis. This is an inflammation of the kidney tubules that can be caused by certain antibiotics. Symptoms may include fever, rash, and decreased urine output. Direct toxicity. Some antibiotics can directly damage kidney cells, leading to decreased kidney function. Blockage of the kidney tubules. Certain antibiotics can form crystals that block the kidney tubules, reducing the kidney's ability to filter blood. Some antibiotics have a higher risk of causing kidney damage, including aminoglycosides such as gentamicin and amikacin are known for their renal toxicity. Amphotericin B, an antifungal that can also cause kidney damage. Cephalosporins, although most are safe for the kidneys, some can cause problems in people with certain medical conditions. It is essential to understand that antibiotics are powerful medical tools, but their use must be strictly controlled and prescribed by health professionals. The indiscriminate use of these medications undermines their effectiveness and can cause unwanted side effects. We are all responsible for taking care of our health and that of others. Avoiding self-medication with antibiotics and following medical instructions to the letter are key actions to preserve the effectiveness of these medications and guarantee a better quality of life. 7. Lithium, a chemical element, has been shown to be a highly effective mood stabilizer in the treatment of psychiatric disorders such as bipolar disorder. By balancing the activity of certain chemicals in the brain, it helps reduce the manic and depressive episodes characteristic of this condition. However, as with any medication, lithium can have side effects, and one of the most concerning is its potential to accumulate in the kidneys. This accumulation of lithium in the kidneys can lead to the development of nephrogenic diabetes insipidus. The kidneys, unable to reabsorb water efficiently, produce large volumes of very dilute urine, which further aggravates fluid loss in the body. The direct consequence is chronic dehydration, manifested by intense and persistent thirst. This not only puts the kidneys at risk, but also the blood-water balance of other organs, such as the heart and brain. According to studies in patients with bipolar disorders, in 10 to 40% of long-term users, lithium therapy was associated with nephrogenic diabetes insipidus. That's it for our tour of these 7 medications that can negatively affect your kidneys. Our kidneys work tirelessly to maintain a delicate balance in our body. Through a complex filtration process, these organs extract waste and excess water from the blood, producing urine. This function is vital for eliminating harmful substances and regulating electrolyte levels, such as sodium and potassium. The kidneys are much more than simple filters. They are master regulators of our body. In addition to eliminating waste, these organs help control blood pressure, produce hormones essential for the formation of red blood cells, and help muscles, bones, and the heart function properly. Simply put, the kidneys are essential to our overall well-being. However, despite their essential functions, these tireless workers are extremely sensitive organs that require our care. Despite their critical role in filtering the blood and removing toxins, they are extremely vulnerable to a wide range of factors that can compromise their health. The relationship between medications and kidney health is complex and delicate. Although drugs are essential tools to combat diseases, it is essential to use them responsibly and under medical supervision. Knowing the risks associated with certain medications and maintaining open communication with your doctor are key to preventing kidney damage. Another recommendation is that you do not stop treatment without consulting your doctor. Stopping treatment abruptly may increase the risk of complications. Tell your doctor about all medications you are taking. When you see your doctor, tell him or her about any pre-existing kidney conditions you have, so he or she can choose the best treatment for you. If you need to be treated for high blood pressure or any other health condition, it is important to monitor your blood pressure regularly to make sure the treatment is working. In addition, it is vital that you constantly monitor your kidney functions. These medications can have side effects. Talk to your doctor as soon as possible if you have any symptoms that include persistent fatigue, changes in urine, or inflammation in your body. Your doctor will likely adjust the dose or change the medication. The kidneys are the guardians of our health, working tirelessly to keep our body clean and in balance. Remember that prevention is always the best medicine, and taking care of your kidneys is taking care of your health in general. Thanks for joining me. Did you like the video? If so, give us a like and stay tuned for our next health and well-being meeting. See you soon.